All right, now we're going into the ICU machine.
So just connect it here. The ICU machine has to be plugged into the special ICU outlet,
Yeah,
and so this one, and there's one over on the other side, has to be the ICU one, or otherwise the machine will
Power
malfunction.
drainage is wrong.
So
Pop that in there and turn
pop that in there. You don't do anything with this yet. You turn on the machine.
Okay.
And before you start the oxygen, you have to calibrate it.
Okay.
And you also have to change the soda lime, and so that's in here.
Yeah, we know to guess that.
And then this just pulls out. You change it every time for the first time that you use it, and then every 4 to 6 hours depending on your patient's needs.
Where is the soda lime in that little thing?
Right here, or up above the scrub sink.
Sink.
Yep.
Up above.
Right.
Up there? Okay. All right. So that's the extra soda lime.
And then if you don't get this hooked back all the way, it'll leak oxygen and it won't go up.
It won't prime.
So yeah, make sure that's all locked in.
I'm sure it's a funky odor.
So go to where it says monitor, go to your oxygen. You have to calibrate the machine first.
Okay.
So hit calibrate and click OK.
Okay.
And then it'll drop it down to the 20 mark. You can have this open or not, it doesn't matter when you calibrate it. You should wait about 10 seconds before you start your oxygen to make sure that it's not going to go more than 0.5 away from
20?
Yeah, where it starts, the 20.9 or wherever it starts.
Okay.
And then if it does change drastically, then you have to calibrate it again.
Okay.
Make sure your set points are where you want them before you start, and then
And that's just touch screen, so...
yep, this is all touchscreen. If you wanted to change it, you can change it higher.
Okay.
Go here, active output, and now you're starting your oxygen.
So active output is how you turn it on?
Yep.
Okay.
And then you go to chamber, and for your patient's heat needs or cooling needs, you can adjust it in the chamber setting to whatever you need.
Okay.
And then go back to the main, and there you are, and it'll tell you everything that's going on.
Okay. Piece of cake?
Piece of cake.
Okay. Any complaints that you have with it? Is it finicky ever?
The only time that it's finicky is when this little piece right here needs to be changed, and that needs to be changed every 6 months.
This piece right here?
Yeah, it pulls out. It's a little canister. It's
All right.
difficult to get in and out
Okay.
of it.
So
If-
when it goes wonky, what does it do?
It'll just start alarming and
Oh.
say that it's not oxygenating even though the oxygen's flowing.
Okay.
If it does alarm and there's no oxygen, it says it's low concentration for whatever reason, you're probably out of oxygen and need to change
Okay.
the tanks.
Okay.
Okay?
And so when that does happen, do we have the spare part already or not?
We do not, because it expires once you order it. The clock starts ticking on
Oh.
it. Yep.
Okay.
So, and you guys know where the oxygen's at?
Is that labeled when it was last changed? Is that like the mystery?
That's a good
I'm
question.
not sure. So oxygen's in here, and we have the 3 tanks. This one's empty right now, but these 2, and so whenever this one runs out, which it looks like it has about 700 left, you have to pull the regulator off of this one and put it on that one.
Is that difficult to do?
Not really. The wrench is up above there,
Okay.
and just make sure your tank's off
Before
before
do
you
it.
disconnect it.
Yes. Just like you're changing your
Yep.
gas on your barbecue.
And little extra
Okay.
E tanks for the individual anesthesia machines if you run out of the big ones.
All right. Sounds good.
Yep.
Okay. Are we done with this one?
Yep.
All right. Here we go.